Whoa, wait a minute, I got the wrong thing here. Not good. Town of Dayton Board of Health regular meeting, November 19th, 4:31, it looks like. This is also a remote participation Zoom meeting. It is a public meeting being recorded for cable broadcast and internet posting on YouTube.com, Town of Dayton. I'd like to call to order board member introductions. You want to start, Tammy? Your name?
Oh, sure. Tammy Mello.
Barbara Catavia, Chair.
Vincent Hebert, member.
And next we should do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Old business. Review, discuss grant document, shared drive capability and startup. Vinny, would you like to take this?
Sure, I certainly would. I did have a conversation with our TA, and he had said there was nothing like that in any town that he knew of. But I said, well, let's do it for this town.
Yeah.
And he understands what we're looking for, how to lay it out. Very straightforward business, server type of folders, and then with access for other people. So he's got a lot on his plate. Like right now, he said he couldn't promise, like tomorrow, but he would look into it and he would do it. One of the things that I mentioned to him, which I was speaking to Liz and with Barbara about today, I came down a little bit earlier, is that, so I've looked at all of the grants that are up, pretty much all of the grants that are up there. I didn't find a lot. I didn't find a lot for the state as far as like Board of Health would go, except for the one that I disseminated to everyone here, which I can go forward with, but I have to check with the TA because of that 25%. They want a 25% reimbursement, if you will. So I don't know if it's something like, if it's $1,000, they'll keep 250, or if we have to kick it back in after the fact. I think it's after the fact.
Okay.
But I could go forward with that one, but I'll talk to the TA. I mean, obviously I don't want the town to have to pay anything, but if we're getting the money up front, then that should be sufficient. What I did find is that on a state level, is there are a lot of grants for like police department, for school systems, for fire department, for things like equipment, for things like training, for things like awareness programs and things like that. That's where I was going, was I could take those and take those links and tuck those into a folder that says police, fire, sewage, solid waste, whatever it happens to be, building, anything like that. And then shoot them an email and say, hey,
Right.
Take a look at these grants. Here's some money.
Mhm.
Again, where, this all goes, now we're not taking any money out of the general fund, right? We're just keep that general fund monies there and let them get these grants so that they can do whatever they need to do, right? So once he gets that straightened out, I'm just going to keep doing that. And I'm on like a notification list. So if something new comes up,
You're notified.
in regards to that they'll ping me and they'll say, hey, there's a new grant that's available. Hey, there's a new grant that's available. But honestly, it's like, except for like the one that I sent and the couple of others that are related to there really isn't anything now available for some of the things that we talked about, CPR programs and stuff like that. But as they come up, I mean, I'll run them by the board and then we can say, hey, we want to go forward with it, or hey, we don't. And, but in the meantime, like I said, I can just keep stuffing them into the folders and let the appropriate departments and committees know, and they can have at it.
That'd be great.
Yeah.
Awesome.
That'd be great. Thank you so much,
Oh,
Vinny.
no problem.
Thank you for doing all that hard work.
I hate, like I said, I know you want me to, they all want me to write grants, but I don't have any to write, except
Right,
for that one.
Not right now.
Not right now. So it's unfortunate, but.
But it's always good just to keep your eye open.
Yeah, because as you know, it's like if you've done this, like I did this in my previous job with universities, we'd work with them on getting grants so that they could get funded so that they could buy our equipment.
Mhm,
And the money's there and then the money's gone,
mhm.
right? So you've got to, and then sometimes they take back half of it, so it's one of those games that they play, and then usually there's a time frame, like it's only available until a certain amount of time. But at least we're starting the process so that we can, this is baby steps right now, and then once it all gets rolled and going, like I said, I think it'd just benefit the town as a whole.
They need it. We don't really have a grant writer. The TA, I believe, might be responsible.
Yeah, he had told
Like
me
you
he'd
said,
done
right
that.
now, he's got a lot on his plate.
Yeah, he does.
So anything that can help the town, we're for it.
Yeah.
We've got to,
Yeah, so that's that's at, and then I'm not gonna, bother him or, keep pinging him, but.
Right.
I'll let it set for a couple of weeks and then just say, hey, any progress going on with this, and see what he has to say.
I got a little excited today on a Zoom meeting because I heard the nurse from Taunton said that they had a part-time nurse being paid by a grant.
Mhm.
So I called her up right after the meeting. I'm like, what grant is it?
Perfect.
She said it's the remain of a COVID grant. And it's what's left, and that's why we're paying it. And it was one of the grants that Dayton did not use
Oh,
Oh, no.
because they weren't aware of it.
Right.
And this is what we're doing this now, so we
Right.
can be aware of anything that's coming up.
mhm,
We don't
Absolutely.
let it miss, we don't miss it.
right.
We've got
That
to,
would have all been money saved if we did hire a nurse, right?
oh, yeah, well, it looks good.
Yeah.
It looks good. It looks great. I'll say that, I'll talk about that at the end of the meeting. Anything else you'd like to add?
No, what was that?
Yeah, so like I said, that I'll check back with him in a couple of weeks and see if he's made any progress with it.
That's great, Kenny, appreciate it.
No problem.
I know it takes time. That's why we have you doing it.
I don't mind doing it.
Thank you, I appreciate it. New business. What's Up Cupcake refund request. We have a request here. I will read it. Dear Board of Health, the owner of What's Up Cupcake has requested a refund for her annual food license. She attended the Bristol Aggie Fall Show on October 19th, 2024, and failed to provide her certificate. At that time, Chairwoman Barbara Catavia requested she return on the 20th with her permit. Jennifer Bouchard, the owner, came into the health department that following week and spoke to Barbara Catavia and Elizabeth Mora. How do you say your last name like I don't know it?
Morera.
Marrera, requesting a $125 refund due to loss of sales. Please see attached invoice for payment to What's Up Cupcake. And she did send us an invoice. So I shall tell you what happened. We couldn't have weren't able to have our regular food inspector for the fall show at Bristol Aggie. I went over and inspected the food trailers and trucks. This lady had a cupcake truck. I didn't see the placard that when they come and get a permit, we then go out and inspect the vehicle and we give them a placard that they have to leave in the front window. It wasn't there. I asked her where it was and she said, I don't know. And she pulled out a cabinet and started, papers were flying every which way. Couldn't find a receipt, couldn't find inspection, couldn't find the placard. I said, well, sorry. Yeah, I don't have any record of you right here. Maybe back at the office, but I don't have anything here. And I said, you're going to have to close up, and explained it to the person running the fall show, this lady that was there. And I said, but listen, go home, look and see if you can find the paperwork. And then here's my phone number, just text me. And I will come back tomorrow morning, make a special trip to check you out, and you'll be all set. She said, okay. She was a little upset, but wasn't too very, very upset. And she did. She found it about 8 o'clock at night. She texted it to me. I said, great, what time are you coming? What time do you want to meet tomorrow at Bristol Aggie? And she said, I should be there about 8:30. I said, okay, I'll be there at 8. I was there at 8. She never showed up. I left at 10. A few days later, I'm not sure which day it was, to be honest with you. She came in and was very, very upset. And was very upset with me, basically, and wanted a refund, which I believe she's gone to 1 or 2 other events in the town, but I don't think she should get it back. I mean, she had the opportunity to come back. I was going to make another trip special for her.
Mhm.
And
Was
she
the
didn't-
fall show that second day?
Yeah, it was Saturday and Sunday.
Saturday and Sunday. So she didn't show up at all?
She didn't show up at all Sunday. She just showed up that Saturday.
Mhm.
I'm gonna say the same, I agree with you. I mean, it's your responsibility as a business owner to have the appropriate paperwork with you.
And especially, it has to be on the window.
Right.
I mean, I had a food trailer for about 5 years, and every town, I went to about 7 different towns.
Mhm.
And each one would give you a placard and you keep it in a manila folder and you keep it in a safe place. And when you go to that town, you put it out there
Mhm.
because that's your proof that you have paid for
Right.
the permitting and you have had it inspected, which she had neither.
Did she say why she didn't show on Sunday?
No, I don't believe she did. Elizabeth, do you remember her saying anything about why she didn't show Sunday?
That would have been maybe a mitigating factor, like something came up and she couldn't
No,
show, and then maybe we give her half the money back, but I say no,
no.
no.
I say no too.
No, even half the money, it was her responsibility. It was her responsibility to have it there.
Absolutely, because every other vendor there had to do the
They
same.
did,
thing.
and they all had it.
Yeah, so,
They all had the paperwork, they
Yeah.
all had everything.
she said, oh, I had a family member that was sick and I couldn't show up Sunday, and I mean, but to just not show up and then not give an
No,
explanation.
it wasn't a courtesy, because she had my phone number.
And you were there 8 o'clock in the
Mhm.
morning on Sunday,
Yes,
and she had your information and never contacted you, I say no. It's my vote.
okay.
I
Does
agree.
anyone want to make a motion to not pay her?
I'll make the motion to not pay. What is it? What's up, Cupcake?
Yeah, what's up, Cupcake? Refund.
I second that motion.
Okay, could I have a count, please? I mean, yes, vote.
Aye.
Aye.
Aye. And it passes not to give the refund to What's Up Cupcake. Second on the list, solid waste recommendation for trash bag price increase. Okay. Solid Waste Committee met Monday, November 4th, 2024, and voted to recommend to the Board of Health a trash bag increase for the pay-as-you-throw program. Robert Perry made a motion to raise the price of the large trash bags from $20 to $28 a roll, and the small would increase from 10 to 15. They took into consideration the elderly are most likely the residents who purchased the small and only raised the price by $5 versus $8. We had thought long and hard about this. And it was needed.
Yeah,
It was needed. We definitely didn't want to do it. We're trying, the Solid Waste Committee is working really hard, trying to find grants, trying to work with DEP. We're getting bonus monies there to help out with some of the things that are needed up at the transfer station. And this is one of the things, we just couldn't absorb all of it. We
Yeah.
had to help out.
I mean, I don't know who, I was at that meeting where who was the gentleman sitting across from me? I don't know. It wasn't Bob, he was right across from me. I forget his name. But he was the one that was giving the numbers.
I forget who that was.
Yeah,
That was
because he was
a
like
couple
giving
weeks
out the,
ago.
like what the costs were. And then as we were going back and forth, even at $28, it should be 32.
Mhm.
It should be 32 for it to break even.
It's a lot of money.
So there was, and that's it, exactly, Tammy, because as we,
I think differently, and no disrespect to you two, I think differently on these trash bags. But that's my opinion.
no,
You know,
opinions
some of the
fine.
towns, they have a yearly fee. And
Yeah.
it's a lot more than this. And it's not, you can have a family of 20 pays the same amount as a little old man or a little
Sure.
old lady.
The only reason I disagree is because it's just more plastic in our landfills. So most of the time people are taking, and when I bought or purchased the bags, you would bag it up and then you would put it inside another bag. So it's just more bags in a bag sitting in the landfill. So again, no disrespect to you two, but I think so differently about the trash bags. I don't think we're helping the environment by just
Yeah, I don't know,
doubling up on all these bags and.
I don't know if those bags,
Cost.
if those bags are something that is like more biodegradable than anything else. I don't know.
I don't know that either. I know there are some bags that are. I don't know. I don't have the
know. What do you
knowledge of
think,
that.
Liz? Have we gotten anything on that?
I don't think raising the price is gonna increase the bag sales. I think it'll decrease.
It decreased them because most people like myself went to,
They're gonna find
um,
other means.
right, went to,
Or,
Yeah,
dumpsters.
so part of like, so when we were discussing like the pricing, one of the things that came up was like the dumpsters.
Mhm.
And the dumpsters are more money than the bags. Now, again, that's kind of, and that's probably in general terms, because for me, it's me and my wife. We use one bag a week. That's it. And, but for somebody else who has a larger family or somebody else who has
Or farm.
a farm,
Myself.
you know, or a business or something
Right.
like that, that's maybe that's more cost effective.
Yeah.
But I think that's few and far between. The bottom line is like the way that the pricing, I mean, I was the one who worked out, what the pricing was. And then when I said, if you want to break even, you have to charge $32. I said, that's too much money.
Mhm.
It was a lot of money.
the cost of disposal is increasing and we're not raising the price on bags. So people aren't gonna buy more bags because they don't money, so it's not gonna create more plastic waste. It's really just increasing the cost of the bags. So
Yeah.
if anything, I think it'll decrease because it's gonna deter people from.
Mhm.
When,
And
one
plus the
of,
bags are so thin, they tend to rip. They don't even hold anything.
one of,
That was many people's complaints that I've seen, over on some of the town pages on Facebook.
one of the things that I mentioned is to be transparent and to give them the numbers. So when this letter is supposed to go out in January, I believe, is explain what the costs are. It's not the bags, it's the program, right?
Exactly.
Right? And people, and you can hear it, it's like $28 for garbage bags. Well, it's not $28 for garbage bags.
And
It's
this is-
it's $28 as part of the program because the
Right.
costs have gone up. Show them the cost, show them what we had all the numbers that were there. Show them what the costs were, show them what the increase was, and show them that we're still running at a deficit. Even at
Still, this-
at $28, we're still running at
This
a
isn't
deficit.
touching it. This isn't
Oh,
touching.
sure.
I mean, and actually, like, the smaller bags were probably should have gone to like $20.
Mhm.
Should have increased by
You're in a roll.
20, I think,
10.
10.
10.
10.
Right now, they're $1 a piece and $2 a piece.
Even in the small ones, it's 10?
10.
Is it 10?
Mhm.
So the other thing that we talked about was, so as I crunched the numbers, I said, well, you should really take that and that should really go to 20. So we took some and we're like, but most older people with smaller, really small homes are only going to use the smaller ones, right? So we don't want to put the burden on them so much. So we took some of that cost and moved it over to the larger bags and then even still cut that back by like $4 for the pack because it's just $32 is just, it's too much money, I think.
It is a lot, but what else do they want to hire somebody from out of town? Do they want to do dumpsters? I mean, and that's all going to be more money than this.
Right. And that would, would it be a fee that goes into your, into your taxes, or is
And
it?
that's extreme. We've checked
it's a
on that.
complicated-
Those towns are
Yeah.
crazy, $200, $300, $400 a year.
But do you look at the,
I pay, it costs me $250 a month for my small dumpster. I think it's a 2 yard, I think I have.
yeah, but you,
Is it that expensive?
I was paying 85 a month. And
Yeah.
then it jumped right up to 125 last year.
So you
Well,
do-
for this year
oh,
in
last-
January.
but I,
So what are you paying now for that one dumpster per month?
$250 a month.
So it's gone up from 85?
$85 to 125. They come bi-weekly.
Oh, okay, they come
Sorry.
bi-weekly.
I
Okay, I
said
didn't know
that,
that
if you-
part of it. Okay.
so
Yeah.
again, I said, what really, extremely important is to break it down by the numbers. Tell them what the whole program costs. Tell them how many, he had all those numbers. That's
Yeah.
where we got it from.
Liz has all those numbers.
Yeah, this is where this is the cost of the program.
Mhm.
Even at this, we're losing money. They have to take it out of the general fund in order to make up, for that $4 $4 a roll deficit. And, it's $2 more a week when you break it right down to it. I'm not trying to be salesy or anything like that, but it really, that's what it comes down to. Is, if you were paying that, now you're paying an extra $2 a week. So, your options are a dumpster, your options are a private service, your options are going to be more costly
Mhm.
than this.
They are, we're trying.
The city of Taunton does it, Berkeley does it.
What does Rehoboth do?
I don't know.
They don't have any.
They don't have anything,
Anything.
so people are responsible for their own stuff.
They have their dump and I believe you can bring everything there yourself.
Okay.
Or
I know
you can
Swansea
hire
does
a dumpster.
bags.
Mhm.
You know that.
So there's more than a few towns that do the,
Fall River does bags.
yeah,
Mhm.
because it's, like I said, to me, it's the fair way to do it, as fair as it's going to get, because like I said, it's me and my wife. It's one bag a week. And even then, we could probably use half a bag a week,
That's a dream. Oh my
It's-
gosh.
because it's just the two of us,
Do you
right?
recycle?
Hmm?
Do you recycle?
Yep. Yep. So
That's the other thing, nobody in town pays anything to recycle.
Right,
there's
A
another,
lot of
Yeah.
towns have recycling fees.
right.
and there's
Sure.
the other piece that we could roll into it is like, I don't know if this program is including, the recycling and as the whole piece of it. That would be something that you could add in. You're not being charged for recycling, and you can use examples. Here's another town. They
Right.
charge
Right.
recycling on top of the bag fee, on
Yeah.
top of this. So, as long, again, I think I think you're starting to hear some people who will be upset about it. You know,
Do you
But-
want, do you want to work with Liz
mhm,
on sending out the letters?
I'll do that.
I mean, would you like to have Vinnie help you?
It's up to you, Liz.
It was
Research.
discussed at the solid waste meeting that they could potentially put a notice in
Mhm.
the tax bills that go out.
So I'm thinking with Vinnie's suggestions, maybe we'll,
We would have to get this recommendation from the Board of Health to the Board of Selectmen before their next meeting.
mhm.
And I don't think we're gonna have enough time to do it, because tax bills go out next week.
Tax bills go up next week.
Well, they have to get it to the company that sends them out. So all the information needs to get sent to the third party they use.
Mhm.
So for them to add it to the envelope, I think it's too late for us now.
Okay, well, we can also send out a postcard or send something else. I think it's worth it. That maybe we could find
Yeah.
somewhere.
I don't use BP to make a postcard, but it was fairly cheap,
Really?
yeah.
Maybe we could do something like that.
And then we don't pay postage, I think it's called like a door to door or where they just deliver one to every house.
Now, what about the,
Okay.
what about the one sheet that they fold it 3 times? What is that like a regular letter or is
That
that?
would be a regular letter. You would have to put it in an envelope and stamp it. If we got a postcard, it would just be the postcard. And it has.
Is there a size limit on that postcard, I'm wondering?
I don't think so. The last time I tried to get a quote from BP, it was, I want to say it was like a 5x8 postcard. And it was fairly cheap. I can look for those numbers.
I think it'd be more official with a letter, to
We
send,
would.
to send it out.
Although I'll tell you, I think if we made a really eye-popping postcard fairly large. People are like, what's this? Where a letter, they're like, oh, yeah, it's the town,
I agree with you, Barbara, on that.
you know?
It just, that I don't know how much of that we could fit.
Or how about this? How about if you put just enough information on the postcard and you can put that there's more information, could we put on the
On
town
our site,
website?
our
That's
website,
an excellent
For more
idea.
information, go to the town
So
website.
if you want to see,
we have one too.
you could give them like some of the breakdowns and the numbers, and if you say, if you need more details on where these numbers have come from and the reasoning why, you know,
Yes.
go to this website. Good idea.
Absolutely.
Yeah, great
And I
idea.
think the eye-catching postcard too would be great.
Use your QR code, you can just
Use a QR code.
scan it.
You know I don't know how to do that, right?
Most
You know
people
that. You always say that, and I'm like, I've tried 3 or 4 times, it's like, yeah, I'm all set.
Take a picture. That's all you gotta
I try, it just doesn't work.
It doesn't always work with my phone either, so, and it's.
I have a very old phone, I'm attached to it.
I have a new phone and I still sometimes can't get it done.
do. No, that's a good idea.
Okay, so
Today you would need to make a motion to
Yep.
recommend it to the Board of Selectmen.
anybody like to make a motion to send these price increases to
Board of Selectmen.
the select?
Sure, I'd like to make a motion to send that price list to the Board of Selectmen, so in the future we can send out a postcard.
Second,
Well, you want to make a recommendation to increase the bag price.
Yeah. increase
Oh,
the
okay.
prices,
To 28
yeah.
and then send
Okay.
it to 15.
Got it.
Do you want to change that motion?
Sure, I'd like to change that motion. Can I make a motion to make a recommendation to the Board of Selectmen to change the bag prices, the large trash bag from 20 to 28 and the small bag increase from $10 to $15?
second.
Could I have a vote, please?
Aye.
Aye.
Aye, motion passes.
Thank you, Liz.
We love you, Liz.
We couldn't do it without you.
Save us. Okay, next, per diem health agent. We all know we've been trying to get a really great health agent. And it's been a little tough. But with the Northern Bristol County Public Health Alliance, they are hiring a health agent to work between 5 towns that belong to the Alliance. Dayton is one of the towns. So we could have him or her come in and work a day or so, or recommend different programs. And we have 2 applications right now for a part-time health agent. So I think we should have them come in and
Sure.
interview them.
Yeah, the resumes
Sounds
look good.
great.
I know this is taking a while and we did have interviewees before, but we really want somebody, we don't want this as stepping stone up their career. We would like someone to come in, stay with Dayton and really help out and accomplish something. So that's why we're being real picky. We're sorry, but we are being picky. We want only the best for Dayton.
What would the compensation be for the per diem amount? I know it's Matt Tanis.
Yeah.
We talked
Yeah.
about that.
We're
today.
working because it probably will be less hours, so we can raise it per experience. And we can hopefully go that way. Plus, we will be having the health agent provided by the Northern Bristol County Public Health Alliance, and that is no charge.
Okay,
That is a program that has a very good grant system. And they help us with the nursing, the health agent, and they've got a couple other things they're doing too. They're very good. They're very good. And it's mostly made of nurses of the towns and the health agent and or the board. And the people that are on it, smart, smart and right up
So
to par.
question, has this already started, this program? The nurse
yeah,
and the
it's
health
been in
aides, they're
effect.
already out there.
It's been in effect about a year and a half. They were doing the base of it. Right now, we're running interviews. We had 2 today. I was on a Zoom with them and very good, very good for nursing.
Oh, nice.
And I believe we did find a nurse who was phenomenal. She won't be able to start until the beginning of January. So we'll just have to muddle through there.
Mhm.
But a lot of the other towns have programs already in existence. So she'll be going in and kind of fine tuning. Dayton, we don't particularly have a program. We don't have a program for dental examinations in schools. Some of the other ones do.
Mhm.
There are so many different programs out there that we can provide free of charge. And like the grants, I don't know where they are.
Mhm.
These people, they're phenomenal. We all work
Nice.
together and they all help one another.
It's really nice.
And it's nothing but a plus to the town of Dayton. Nothing but a plus. And that 24/7, you can call the secretary up, the girl that's running it also, and she'll point you in the right direction. She'll get you an answer. If you need something specifically, very quick, there you go.
That's awesome.
Yeah, it's very good.
That's great.
Extremely good program, extremely good. I'm so happy. They decided 3 or 4 years ago to sign, for a while there, they were like, no, we shouldn't do it, and da-da-da. But they did, so I'm glad. I'm glad they're doing it, and hopefully in the near future, we will have things running very smoothly around here. Okay, the next one, complaints, feedback, bond and stable
You want me
permit.
to call and schedule interviews with the 2
Oh, I'm
candidates?
so sorry, Liz, I do. I'm sorry.
That's okay.
Yes, please do. All right. Appreciate that.
I'll see what.
So
I can
much.
Schedule.
Great.
Yeah, and if we could maybe have an emergency meeting and with that, and then we could present it to the selectmen. I think they have a meeting next Wednesday, and I think they're pretty booked, but maybe knowing our circumstances, they might squeeze our recommendation in.
Would we all need to interview this nurse and then make the recommendation to the selectmen?
Yes, like we did last time.
Okay,
Done.
but you already said you talked with her and she,
Yes, she was on, yeah,
okay. All right, so that's the procedural piece of the whole thing.
I'm sorry, that one we don't need. That's another one that's coming in.
Which one?
Part-time nurse. The agent, we're all set with the agents, not the nurse. The nurse isn't, we haven't got the paperwork
But
for her yet.
Doesn't it, all that still have to be recommended to the selectmen?
Yeah.
Yes,
Okay,
but let me get a hold of her tomorrow, or you can get a hold of her tomorrow.
The nurse?
Yes. The
Do
part-time.
you
nurse.
want to interview the 2 agents though?
Yes, definitely the 2 agents, but at the same time, we probably could get the nurse in here too.
Yeah.
yeah.
And do
Do it all
it
at once.
also.
Yeah.
And that way we have 3 to recommend up to
All right.
the
Yeah,
selectmen,
that's a good idea.
and, yeah. I think that the nurse that we do have, I did talk to, she, would be able to start almost immediately.
Okay, good.
That's our part-time nurse, and then there's also the Alliance,
Okay,
their nurse is another one on top, so we'll be having almost 2 part-time nurses.
Good.
Covering, working together, so that would be great.
so one our own and one from the Alliance.
Yes,
Okay.
yes.
And then
yes.
the other 2 resumes or applications that we received were for the health agent.
Yes.
And we would still maybe have access through the Alliance for health.
Oh, we
agent?
still do.
Okay.
We haven't got one yet because I'm dragging my feet there too.
Yeah.
That's okay.
I'm like, I would like someone that knows what they're doing.
Right,
Or basically can touch on everything. A lot of them coming in, as you know, they've gone to college and they're public health graduates and have no knowledge of the septic and that end of it.
Mhm.
And what would you say the percentage of us having to do septic work?
Mm, At least 65 to 70%.
I was gonna say that. I was just waiting to see what you were gonna
What
say.
are- what are the raw numbers? Do you know, Liz? Like how many are done in the town in a year?
Yeah, I can get that. We report on that every year for the
Yeah.
annual
Yeah.
report.
So I'd be curious to see how many septic inspections per tests, whatever is involved for,
Yeah.
for a health inspector in the course of the year. And where I'm going with this is that, so if we had Matt Tanis, right, we have him,
Mhm.
we have these other two people. And then, you know, with that, we can figure out, it's like, okay, how this is gonna be divvied up between three people, you know?
Well, it depends. If we get a part-time agent in here that can do all that,
mm,
we may be able to just, I hate to say it because both of them have been so good, our inspectors.
Yeah.
We may just try to cover it ourselves.
You know, and if we can, that's great, but if we always have
Oh, yes,
some people that are
definitely.
in reserve, right? So if you, I know this,
Sort of a backup if
Oh,
our
yeah,
person's not
definitely.
you have
available.
this person, Matt Tanis, who's been doing it.
Oh, he's been great.
He's very, very busy, from what I
He
understand,
is,
so
yeah.
I am gonna just reach out to him just to touch base and say, hey, you know, here we are, Board of Health. But there's the thing, like, even if we have a part-time person and they can't cover and something else is coming up, you can bring in one of these people that are per diem. And,
Exactly.
You know, from what you said, they are fine with that. That's what they would really like to do. Great,
It's great.
you know, so then we're,
Win.
win-win, we're covered, right?
Yes.
But if we could get just the raw numbers, I'd be curious just to see what those are.
Mhm.
Look, I don't know.
And this health agent that we're interviewing, he'll be able to start, I believe, immediately also.
Oh, nice.
So we're getting there, guys.
Mhm.
We're getting there.
Nice.
And I think it's been worth it holding off and going through the rough time. Yeah, because I hope so. I hope this time everything works. We've had, we think we're all set, then all of a sudden it's like, oh, no. There goes another one. But maybe it's meant to be. We've come a long way, guys.
No, we certainly have,
We're gonna get better too.
certainly.
Okay. So you're going to talk to them,
I'll schedule the interviews.
make sure. I'm pretty free, but
Yeah.
how are you going, Vinnie?
Pardon?
How's your days as far as interviewing?
It's fine. I mean, I've got,
I gotta see what, they both work, so I gotta see what
Yeah.
day it is, you know what I mean? It's most likely gonna be in the afternoon.
that's probably fine. Usually afternoons are okay with me. I've just got City of Taunton, the elections meeting Thursday morning, 10.
Okay.
Other than that, I can make an accommodation.
It should go pretty quickly. I mean, it shouldn't be long drawn out, like 4 or 5 interviews. It should go pretty quickly and we can get through it pretty quick.
Yeah, we get it all done in one meeting and that way we're done.
Getting there, guys.
Okay.
Okay, let me see what else there might be here. Okay, items not reasonably anticipated with,
Skip over one.
E,
E5E, complaints, feedback barn, and stable permits.
oh, I did that on purpose. No, I didn't. I didn't, I'm sorry. I put a check mark right next to it. Okay. Stable permit, we did reenact. We voted to reenact it and we did reenact
The barn.
the bond. Which actually, I think we're, because of the confusion, we had talked about changing the name to animal stabling permit. So basically, it will handle all animals, including horses and all other little donkeys and llamas and everything, except for canines, except for dogs.
okay, so you're talking about having one?
I would want Stacy's. view.
Yes, from my understanding, horses is overseen sort of by the state. So that gets reported, I
Yeah.
That's the
believe, to the
bond,
state.
yeah.
Yeah,
Leave the horses
Yeah,
out then.
I think we should leave
Stacy
the,
might have more input on.
yeah, the stable.
Yeah, she couldn't come tonight.
No.
Yeah.
Okay,
So maybe should we
just horses?
table that for
I would
next
table it, but I did
meeting
want to
and have
mention,
Stacy here?
Yeah, I tabled the whole combining of it, but I did want to mention the feedback I got. So there was, the price was one thing that, it went from 10 to 25, so it was a significant jump. And then I added to the packet a new stable permit because the way we worded it is we were keeping track of who has animals in case of evacuation and any type of disease.
Okay,
And on the stable permit, there was nowhere for them to list what other animals they had.
okay,
So if we're keeping track of what animals are where, then the stable permit should have a list of what other animals we have.
okay. And who did this? You did this?
That was one of the feedback I got from one of the residents. She
Okay.
said, well, if you're keeping track of animals for barn permit, how come you're not keeping track of animals for stable
Stable.
permit?
So tricky. But again, I think that should be, I think if we table this, it's a good idea because I think we really need Stacy's input on the stable license or stable permit because she's the person who responds to the state.
Yeah.
So I don't want to have,
For the stable, it's just for
Yeah.
tracking purposes.
okay,
Yeah.
Because if you read below, it says this information is being requested to prepare for an emergency where animals will need to be evacuated of disease, first world, notifications or quarantines would need to
okay,
be required. So to add it to the stable would just be me tracking it,
okay.
but Stacy's
Yeah.
input would be good.
Yeah, it's only fair. That's her
I know, yeah.
division,
Yeah.
her expertise.
Stable it.
Yeah, so I think we should table it.
Definitely.
I'll make-
Motion on it?
I'll make a motion. I make a motion that we table, looking into any changes, in the barn and stable permits until the next meeting for input from animal control, Stacy.
Mhm.
Berry.
That's second.
Could I have a vote on this, please? Aye.
Aye.
Passes.
That next, the item before that, the one on the complaints.
Mm-hmm.
Just want to make sure like that we're all, whenever we see the complaints come in, that we all get notified. And how many complaints would you say, you've been doing this long, Barbara, how many complaints would you say you get, the town gets in the course of a year?
I don't know.
To the Board of Health.
Depends what's going on.
I mean,
Depends
round
what's
numbers,
going on.
half a dozen, 10 more?
This year seemed to be a little higher for some reason. Last year, I don't remember getting that many complaints.
Yeah, 'cause I-
Probably 10.
Yeah,
This year with the rat complaints, it's skyrocketed.
well, that's the one,
That's
so
a big problem.
that's what I just saw was when I was looking at the meetings from the last meeting, I had to leave.
Yeah.
Was the one on the rat complaint that was coming into town. So I'm just curious, it's like how many there are. And again, to go back, is there like a 30-day response time that's in place? I mean, is that what they're expecting? So
Oh,
something
no, I usually go right out.
right out.
I usually go right out. When there's the complaint, within 3 or 4 hours, I'm there.
So maybe, usually like if you file a complaint with a company or a group, like I just filed a complaint with like Tufts Health, like we want 30 days, you're gonna have a response.
Mhm.
On or before 30 days, right? Now, that's something that might give everybody breathing room, right? Gives the town a little bit of breathing room in order to address that, unless it's something that is like it's vermin, like with rats. Is that going to be something that has to be done immediately?
I think that would have to be done on a time.
Board of Health is
fashion.
different than that, than a lot of other things. The Board of Health is immediately,
Okay.
almost everything out there. Am I right, Liz?
Yeah.
I mean,
It's a health concern.
it's a
Right.
health concern. We would never go 30 days. We'd at least call right back
Yeah.
and talk to someone, or Liz would call me wherever I am and say, hey, this is going on here, this is going on there.
So that I understand, but I'm talking about like non-health concern types of things that might come our way.
I don't know
Usually
that we
act on
really-
them Anyway.
It's usually all health related stuff.
Yeah.
Yeah, we don't have too many things that let us know. It's really kind of like, it's like the police department, you go.
Okay.
You don't say, I'll do it.
When we get to it, you
Oh, yeah,
can't do
we'll get
that,
to 'em. No,
unfortunately.
I've been shopping and Liz has called me. I'm like, okay, just go, just leave everything and go and
Mhm.
take care of the problem or with the vermin problem in North Dayton. That's one of the reasons we reenacted the bond is because people were having a few chickens or a few ducks, or one person has a potbelly pig. That we ended up going in, the lady was very nice and did let us in. And she didn't have to because there was no bond permit, we had no legs to stand on, but she was very nice and let us go in. And it was a clean place, and then she says, I don't see why we have rats, and I said, come here. You see under the fence, those little holes? That's rats. You see over here under your shed, all these holes? That's rats. You see under your front walkway? That's rats. You see under your foundation? That's rats.
Mhm.
And she says, what do I do? I said, well, you can call an exterminator. You can get poison. A lot of people don't want to use it because it can kill owls and hawks and whatever. I said, and what you do is you put the poison down. Now I think there's something else that's out there that doesn't bother other animals.
Hmm.
And put the poison in, cover it up. If it's uncovered the next morning or the next day, they're still there. Make sure the poison's there and just keep putting the poison in until they go. Or if you don't want to touch anything, you don't want to do anything, you have to call an exterminator. And I didn't think it was fair that because that one person had animals, it was affecting all the houses around them.
Mhm.
And it was growing like a cancer.
Mhm.
And I'd
That's
spend
what
my
happens with
weekends
rats.
driving around saying, hi, how you doing? Do you notice any vermin holes? And they're going, what? Oh, no, I saw one run across over there and okay. And I was just trying to narrow it down and
And when you
just
have,
educating
when you
people.
start having holes all over the place like that, that's a bigger problem.
Huge.
Because
Huge
it's not
problem.
just one, there's a lot.
Yeah. No,
It's harder to get rid of.
No, I totally understand, if it's really, water or sewage or rats or something.
Yeah.
It's gotta be addressed right away. I don't know if there were any other complaints that come in that are not, as,
I don't think we have, do we have, and have we had anybody that said, hey, wait a minute, nobody came?
No.
Hmm.
No, we've gone to every single one.
that's good then. I mean,
No,
that's fine.
Liz cracks the whip. I have to go right away.
Okay, no, that's fine.
It's like, you gotta go here, gotta go there. I was like,
Because I mean,
"Oh, on
yeah,
my
certainly
way."
you don't want that. I understand. Like I said, I was thinking about, other things that might be able to respond. Again, I'd have to see, what the complaints were that are coming in. But if they're all related to that, then forget
Well,
that.
yeah, they're related, and then we have some problems, as we did with the septic system. We helped some people out that we found another way to help save them money on it, and it was totally legal. But when they have problems, they come in, they sit down and we talk it over. We try. Liz is amazing.
Yeah. Now, is there any way that that can be shared with all of us when a complaint comes in?
Not really.
Why?
Do you know, what do you know about septics?
Well, no, I'm not talking about,
What do you know about septics?
Well,
just as a complaint.
Not specific.
I'm not saying that we
A
go out and do an
complaint, yeah.
investigation, any complaints.
It could be, but that's kind of my job right now because we don't have a health agent.
Mhm.
And it should be the health agent's job. It's not even the chairman's job.
Yeah, but we should all be aware. Again, I don't know the specifics, but we should be aware, okay, a complaint has come in and it's related to this so that, again, so that we're all in the know. It's like,
Mhm.
yep, complaint came in, Barbara's taking care of it.
It's easier.
Yeah.
We just feel like we all want to be in the know.
Yeah.
Yeah,
It
You
was
know-
nice when we did get, notification of one complaint. It was like, oh, okay, thanks.
Yeah.
It's just, so we're all on the same page. So if something does come of a complaint, we're not sitting here in a meeting like,
No,
I
we
didn't
tried
know
it.
anything.
That's why this little packet is here. So
Right,
you
but it's-
guys
but
have
it's
something
nice
to know what's
to
going
know.
on.
it's nice to know we're three professionals. And that's why they call this a committee,
Well, like
because
I
it's three
said,
people.
this isn't normal.
Right, no,
for
because we normally have a health
board.
agent.
Right, we have a health
But for
agent.
right now, we don't have a health agent, so it's
Well,
just,
it's kind of
nice knowing.
confusing.
Yeah, because
Yeah, it's just nice knowing,
The health agent still answers to the board.
right.
Yeah,
So,
they do, but they take care of the problem, basically, what that is involved. And then they further it on to the Board of Health. It's not something that they call the Board of Health and say, oh, this is going on here,
Correct.
this is going on there.
Correct.
Not unless it's something that we have to vote on or
Mhm.
decide on.
Correct.
Otherwise, the health agent takes control of it.
Right.
Having a monthly report that he.
Right, but it's just nice knowing what's coming in.
right,
Feels like we're part of the
That's-
board, because like I said, we're a committee of three people.
yeah,
It's
so,
not a committee of one
But that's-
person, it's not a committee of two people.
But you're trying to say, you should be involved in the day-to-day running? Is that what you're trying to say?
No, no, we're
Not
just
at all.
saying, can you just let us know if there's any complaints that come in? It's nice to know, the things that, the complaints that are coming in. So even if I run into somebody, I don't really know many people in the town, but if I do, and somebody says something and I'm not like, not that I would be going out and,
Right.
so
A
expressing any
lot of it
business
is
that pertains.
confidential.
Absolutely. I was a police officer for 22 years,
Mhm.
Barbara. I do know what confidential.
so there's the other
So,
thing, is
I
like,
get it.
they have our emails.
Right, but it's nice
They
to
have our
know.
emails, so they could be,
Otherwise,
hey.
it's embarrassing if we don't know what's going
You know,
on. And
there-
then I'm sitting there like,
There
I
was-
don't know.
think it is,
Well, you
somebody's
just
gonna
say it
email you,
hasn't
it's like, hey,
gone
there was a
before the board
complaint.
yet.
Right, but it's still, do you see what I'm saying? It's
I
still
see what you're
as,
saying,
a
but it's
person,
still
it's
the
not-
Board of Health. I mean, when it's something.
right, but we're a committee of three people.
Mhm.
So each one of us should be aware of what is going on as far as complaints.
It also,
It shouldn't just go to one person. It should go to all three of us.
No,
I'm not
you-
saying we're all of us are going out on investigations, but it's nice that we're all involved and we know what's.
it
going
also
on.
gives us a better metric on what's the workload of the health inspector, what's the workload
Right,
of how many complaints. Let's say that all of a sudden, complaints double. And we're like, okay, why is that happening? Why did that just happen? We went from 10 and now we're at like 2 a month or 3 a month or something like that. So that now we're aware, of what's going on. And now do we have to shift and move? Do we have to call a meeting and say, hey, something's going on here? What are we going to do to address it? Like I said, I don't know about septic systems. And
neither do I.
I know about septic systems, but to
Right.
inspect them, I don't know that.
Yeah.
But if
But
you're
it's nice to know
aware,
if There's a problem, or say if there's
Mm-hmm.
a big problem with the septic,
So it's-
not that we know the ins and outs of, you know what I'm saying? But it's nice to know if there's an issue that came up.
right, it's
It
volume.
takes 2 seconds. I'm sure it took Liz 2 seconds to
Something
type that
that's
email.
Confidential and needs to be, dealt differently. I can always send an email using the status, confidential, so it. you can see that
Absolutely.
it's Something that.
Absolutely,
Keep discreet.
absolutely.
That's an option.
Yeah, just,
Especially if something is in the investigation.
Okay, but do you know that you can send it all to us, but if we all start saying, well, we should do this, we should do this, we should do that, do you know what that is?
But nobody's saying we should do this, we should do that, we should do that. All we're saying is, can you just notify the other 2
And
people
then
on
what
this
would you
board?
do?
Nothing. We just want to be part of this board, Barbara.
Okay, all
There's
I'm
3 of us,
saying,
and right, and what I'm saying is there's 3 of us here. It's not just Barbara on this board.
no,
There's
that's
3 of
right.
us.
But what
So
I'm
we should be
saying,
privy to any complaint that comes in, just like you do, is what I'm saying. I'm not trying to be difficult, no disrespect to
No,
you, but
no,
it's a
no, no.
3-person board.
and again, we can't, we should all be in the know. Not that we're going to address it, but if it's something that we all know about and, Barbara, you're like, okay, I'm taking the point on this and, and I got this, great, just so that we
Nobody's
know.
arguing that part.
Right, and also so that, again, so that we know is like, what is the volume and what's coming in and how that gets disseminated amongst the people that are working for the board as well. And so it doesn't all go back on you, Barbara,
Mhm.
all the time. You're probably used to doing this because you're the only one doing it for a long time.
no, this is the way it happens. This is the way that the health agent handles things, and we are supposed to have faith in the health agent to realize they're doing their job correctly.
Mhm.
You know, when we get a health agent, I'm not gonna be saying, tell me what's going on in the whole town. That's their job.
Right, but right now, I think you're missing the point. We don't have a health agent. That's why we're saying for right now, until we have one, if we could be a part of what complaints are coming in, it would be great.
And when we do,
Well, then that means we have a meeting every day. If you want to be a part of it and discuss it,
Why would we have a meeting every day?
because we're not supposed to be talking about business unless it's a meeting. Am I right, Liz?
Okay, but nobody,
Decisions.
right,
Decisions.
nobody's
No
talking about
decisions.
decisions. All Liz is doing is sending a message to all three of us saying, hey, got this complaint today. Chickens, North Dayton. That's it. That's all we're asking. We're not
Then-
asking for a lot.
it's an
No,
email,
fine.
text message, it's like, you know, what's going on with this, and hasn't been resolved. And the other part too is that we do get a health inspector person, they're gonna have to give us a report, right? This complaint was here, this was the resolution, this was the complaint, this was that. People in the town might want to see that transparency too, I don't know. But
Just
We're
so
not-
you know, anything that comes in is public record because we're.
Yes, it is.
So anybody can come in and ask anything and I.
Right.
give it to them.
Yeah.
Sure.
But that's all that we're going, this is like, just so that we're in the know, we're not saying that we're gonna, we're gonna go, hop in the car and then drive down and
Absolutely
look at a
not.
septic system, we have no idea that, what
We'll leave that to
what
you.
we're looking at. That's all.
I'm sure I wouldn't know what I'm looking at.
I know it's a big hole.
Sometimes I wonder what I'm looking at too.
But
No, that's all
Believe
we're
me.
asking. Again, no disrespect to you, Barbara. I know
No.
you've been here way longer than I have, longer than Vinny has. That's all we're asking, out of fairness, if Liz can just share with us a quick,
yeah, it's just an email
a
or
quick email on the town.
if it's,
email
It was
page.
me and you at first for a little while, so I was in the habit of just communicating with Barbara and Barbara's here every day. So she comes in and this
Yeah.
happens.
It's just nice to, it feels like we're part of the committee, and we know what's
But just
going
so
on.
you know, when the health agent comes in,
Correct.
you will not be getting all these notifications.
That's fine. That's fine.
No, it's just a monthly report.
Yeah, that's fine.
monthly,
But we're still getting.
Unless you go in and you
information.
hear about something or somebody calls you and says, hey, what's going on about this? Then you can come in and you can ask the health agent,
Right.
what's going on here?
Sure.
or if it's something that's more serious too, right?
Right.
If it's something that has to be escalated in one way, shape or form or another. But if it's like, rats that, are here.
You don't
or-
want to be involved in that? Let me tell you, I don't either. Coming in the office and Liz is like, oh, we got another one. We
just-
got another one.
That's fine, like, just so that we're.
Yeah, that would be great. I would really appreciate it.
Okay, sounds good.
Thank you.
5:30. I've got somewhere to be. Okay, what do we have? Okay, items not reasonably anticipated within 48 hours. Does anybody have anything?
No.
Public input. I don't know. We have so many people here.
Chairs are
I'm
full.
not sure. Schedule next meeting.
The next, the third Tuesday in December is the 17th.
17th, 12/17.
And then we may have that emergency meeting for
Yeah.
interviews.
Call to, schedule the interviews.
Perfect.
Okay, approval of minutes, October 22nd, 2024, special meeting.
I'll make a motion to approve the minutes of the special meeting on October 22nd, 2024.
I will second that.
Okay. Could I have a vote, please?
Aye.
Aye.
And I say aye, and the motion passes. October 29th, 2024, town nurse interview meeting, approval of minutes.
I'll make a motion to approve the minutes from the October 29th, 2024 town nurse interview meeting.
Second that.
And could I have a vote on that?
Aye.
Aye.
And motion passes. It is 5:30, am I right here?
is
Yep,
5:30.
5:30. 1 hour, we did good today.
We did. We got a lot accomplished.
We did good, and this meeting is adjourned. Oh, could I have a motion?
I'll make a motion.
It's adjourned.
I'll make a motion to adjourn the meeting.
I will second that.
Can I have a vote?
Aye.
please?
Thank you.
Ayes have it. And it is adjourned. Thank you, everyone.
Thank you.
See you on 12/17.